Good afternoon. I'd like to welcome everyone to this conversation on COVID-19 and Brazil. I'm Harley Shaken, the chair of the Center for Latin American Studies, and we're very honored to be presenting what we hope will be the beginning of a series of conversations on this critical theme. COVID-19 presents an unprecedented and terrifying threat to Brazil, but that threat all of Latin America faces, as does the United States and much of the world. What happens in Brazil has a very critical impact on the rest of Latin America, as well as the US and the rest of the world. What happens in the US, Europe, Asia, Africa, and other places obviously also impacts Brazil. We have two very fine scholars with us today in Brazil to begin this conversation. Naomar de Almeida Filho has degrees in medicine, public health, and epidemiology. His research is focused on many of these issues, and he served as the president of the Federal University of Bahia in Brazil. Elize Massard da Fonseca is a professor of public administration at the Sao Paulo School of Business, and her research has focused on health policies in Latin America. Both have a relation to the University of California at Berkeley. We know that we are in a highly interconnected world. We are seeing this in unprecedented ways when it comes to this virus, which doesn't recognize borders, let alone walls. One new development before I turn it over to Naomar de Almeida Filho. Earlier this afternoon, the president of Brazil, who has long denied the importance of the coronavirus, fired his health minister. So with that, let me turn it over to you, Naomar.
Okay, thank you, Harley and colleagues, Elize. Well, I try to, first of all, briefly give an idea of what this pandemic represents. It's a global phenomenon. It's a phenomenon that could be classified as a kind of a break in the way the world was. And I show you how it started. Let me do this slide. It started in China, as you all know, but then European countries, especially Italy, came along with that. Spain, the US had a different trajectory, and this is a trajectory much more abrupt than the other countries. This is in a log scale. As you can see, Brazil is in that process too. This is the curve, the epidemic curve of Brazil in terms of cases. But the case definition is different from country to country. There is under registry everywhere. And so death is a better indicator. And so this pandemic has a mortality rate very really worrisome, especially for what they call vulnerable groups, such as older people. And let me try to find this. Yes, this is an animation that shows that China and then Iran, South Korea, Japan, France, Italy, Spain. The red curve is the US. As you can see, it goes up very steep, and then comes Brazil, and this ends up by, which is, so this is the profile of these pandemics at this moment. One thing that is interesting to try to come up with is the different pattern in different countries in terms of proportional mortality, which means that not the number of dead people, but the proportion of death per million people. As you can see, the highest is Spain and Italy. At this moment, as of today, is almost 400 per million. In Italy, 300 people, 93.6 deaths per million people. In Latin America, is the country in the worst position, most hit by the pandemic. It's almost 22 cases per million. Brazil comes next, 8. Peru, almost 8 too. Chile, and 2 countries that share the same level of only 2 dead different days in the calendar of the pandemic. As you can see, there is a variation, an upward variation, especially in the US. And in Brazil, the situation is this one, quickly. This is the pandemic that hit Brazil state by state. And here is São Paulo, where the pandemic started. We are using as a kind of a metaphor that is geological. We call epicenter. For some reason, the common discourse held that, and everybody saying epicenter, but it's a metaphor anyway. And São Paulo has a death rate of 18 per million now, and then Rio, the second epicenter in the country, and Amazonas, Manaus, is the place with the highest at this moment, almost 30 people per million. And the other states in Brazil comes along. And here's my state, Bahia. As you can see, we are still less than 2 deaths per million. So this is the panorama of the pandemics, how it develops in the world and how it hit some Latin American countries, and especially Brazil, which is the country that is producing the highest number of cases and deaths. And I might make some comment afterwards in terms of what a pandemic is as a kind of total phenomenon, very complex and very global in all of its aspects. I think it's worthwhile to take a look at this one. So thank you, Harley.
Thank you. Elize.
Hello, can you hear me? Yes?
Yes, we can.
Thank you very much for the invitation. It's great to be here. Thank you, Julia, for organizing and all the class team. Thank you, Professor Naomar, for the presentation as well. That was very informative. I'm going to talk about the public policies in Brazil, and I'm going to share my screen here. I prepared just a few slides to illustrate my presentation. So as Professor Naomar was saying, this is an extraordinary pandemic. It's spreading very, very fast. And we have seen social science scholars trying to monitor what governments are doing in terms of public policies to respond to the epidemic. Here we have 2 initiatives from Oxford University that's tracking the government response to the epidemic in several countries. And also the Journal of Health, Economics, Policy and Law is also preparing a blog where researchers can insert information about different countries' response. So we are trying to monitor and understand what countries are doing in terms of responding to the epidemic. But this is just a tentative approach to understand how and why they differed in the strategy they adopted. So I hope we will have future research, and in the future when we watch this video again, probably we'll have different explanations, but in terms of trying to understand how they different in terms of response, I brought three possible variables that explain that. One is in terms of historical background, how countries responded to the epidemics in the past. We see that South Korea, China, and some other countries have experienced SARS before. So they were aware of how to respond to an epidemic such as COVID-19. And that has a lot of implications on how fast and the types of measures they take to respond to the epidemic. The second one, I think it's state capacity to deal with health crises. The World Health Organization has what they call international health regulation that was revised in 2005, sorry. And that's a norm, a guideline, so how countries should react to health crisis, and especially influenza crisis. We see now that countries respond very different to that guideline, and how they implemented that differs a lot. And in terms of coordination initiatives, as we see, this is a global pandemic. It spreads through communicable contact. So it's very important that countries adopt coordinated initiatives to deal with this epidemic, especially at local level and international level. And countries such as in Europe, that they have small countries and close borders, and free movement of people and workers, this is particularly challenging. So in Brazil, I want to discuss a little bit of how this implicates in Brazil. And Brazil has successful stories of dealing with infectious disease. We know a lot about the HIV and AIDS epidemic, about the hepatitis C. There is a recent one, hepatitis C epidemic, and how the government was able to negotiate prices of drugs. The HPV, and the government was able to transfer technology to produce a vaccine of HPV in Brazil, and many other experience in fighting infectious disease. Many of this has to deal with the collaboration between the health service and suppliers of health technology, local production of drugs, local production of vaccines, and so on and so forth. We see that in the COVID pandemic, the research institutes, they are also trying to research a vaccine to fight the epidemic and produce other healthcare products. Another point that I want to bring here is the leadership of the state governments in fighting the epidemic. The health surveillance in Brazil is also a broad network of epidemiological surveillance. There are some challenges in terms of health surveillance, especially when we have a new disease. The system is not prepared to inform the Ministry of Health new disease, and this is something that we need to deal with. But also how the state government and the Ministry of Health is trying to design policies that are based on evidence and based on the World Health Organization guidelines. In terms of coordination, I think that is a key challenge to Brazil. Probably everybody here has heard about the challenges of coordinating the position of the President Jair Bolsonaro with the Minister of Health. President Jair Bolsonaro has a very strong ideas and has neglected the disease for a long time and still and somehow the challenges of coordination, both executive organization and the state government, is producing a lot of fake news around the COVID epidemic. It's also very difficult to inform the population about what is happening because there are different opinions around this. And as Professor Naomar said yesterday, I'm gonna let him speak more about this, but we have some measures that nobody else has in the world, such as social, instead of saying social distance, we use different words to explain that, social isolation and vertical isolation, and those are words that means nothing in terms of public health, and he's an expert, he can talk more about this. But that's something that is very challenging in Brazil at the moment. So I think to explain what is happening, we need to look at these three variables together, understand what we have done in the past in terms of fighting epidemics, understand that the leadership of this epidemic is with the state governments and the Minister of Health. They are the ones providing guidance to the population, and probably the situation in Brazil is not as worse as could be because the leadership of this governors and the Minister of Health and health bureaucrats at the Minister of Health as well. And it's been very difficult to fight the epidemic and get a straight response and a fast response because of the difficulty in coordinating different interests around the epidemic. It's hard to say the motivations of President Jair Bolsonaro at this time. Probably, well, what we learn is that he's concerned about the economy, and I think I have just a few minutes more, so I'm just gonna wrap up here with the last slide, and I can come back and talk more about this. But just to finish my presentation very quickly, I want to highlight the importance of having qualitative research at this period of the epidemic. It's very challenging to do qualitative research, but it's also a great opportunity because we can get very close to the information. It's a historical moment, so we can get very close to primary data and information. So, and that can inform health decision makers. And in terms of research in the future, and being able to experience the crisis at this moment is it's a very rich research opportunity. I can talk more about this later, and that's it. Thank you very much.
Thank you, Elize, and thank you again, Naomar. These were very, I think, informative, if somewhat frightening presentations, given what we are grappling with and given the human costs that we've already seen, and I think the great desire to minimize that human destruction going forward. So I'd like to ask you, Elize, if you have a question that you might ask Professor Naomar, and what that question might be.
Yeah, thank you for your presentation. That was very interesting. I think it's phenomenal that Amazonas is also a very challenging state to deal with the COVID. And also we see in HIV and AIDS is also a state that we are having a lot of problems fighting the epidemic. So I wonder, why is that? If epidemiology has some sort of explanation of why is that happening in Amazonas and Ceará as well. We can understand that Brazil, that São Paulo and Rio, those are popular cities. We have poverty, but Amazonas is the state that there's a lot of, we don't have concentration of people living in small places. So I wonder if there is some sort of explanation of why is that happening in those states. Thank you.
Yes, actually, these are gates for tourism. Fortaleza in Ceará, for instance, has several flights direct to Europe. And the gate into the Amazon is Manaus. This probably explains some of the first cases, but then the socioeconomic conditions of both cities are very poor, unequal neighborhoods with several problems, and then what's called the community transmission is quite widespread at this moment in these places. But the bad news is that a pandemic is a series of epidemics, and other places in the country will experience the heightening of the curve. It's now the concentration of cases and death is in São Paulo, and second in Rio in crude numbers, but Fortaleza and Manaus are basically proportionately in a much worse position. And the other thing is that these were places where what we call the non-pharmacological control was somewhat delayed. In São Paulo, not so much, but my state, for instance, started from the beginning a enormous shutdown, but we are experiencing much lower rates. But the question is, the epidemic will arrive, not if.
Great. And then let me ask you, Professor Naomar, for Professor Elize, might you have a question that you'd like to ask?
Yes, I'd like her to elaborate a little bit more on the issue of coordination, because the application of the social distancing is a quite tricky solution, because it needs coordination strategy, really fine-tuning of the different sections of government. And since we in Brazil are in a sort of horrendous conflict, because the position of the president is genocidal, in the sense that he's personally promoting the breaking up of the quarantine and the isolation and the social distance measures by exposing himself and people and encouraging people just to break the rules of the control of the epidemics. And some of his actions are really horrendous in terms of the consequences that should be. So please elaborate a little bit on the issue of coordination.
Yeah, I think what Professor Naomar said is perfect. It's very difficult to coordinate actions when you have a president that was supposed to be the role model for what the government is doing, and he's stimulating his constituency to go out in the streets and to protest against the state government. And but when I say coordination, the coordination between the president and the state government is very important, but also coordination between states, nation states. We see that, for example, the United States bought all the important health supplies from China, and Brazil is trying to purchase some of the some health supplies from China. It's having a hard time to get access protective equipments. And so in this situation, we also need states to cooperate with each other. We see that happening in some states that are trying to help other nations. And in Europe, as I said, it's very important that they take actions together. But this is something that we need to study more and understand how to do that. I was reading an opinion article about the World Health Organization and trying to criticize the World Health Organization for the lack of coordination. I see that's a problem indeed, but pandemics and the scale of the COVID pandemic is so unexpected. We could prepare for something as an influenza, SARS epidemic, and things like that, but this one nobody was expecting. So not even the World Health Organization. So I think it's something that we need to think about and prepare for future experiences. But as the World Health Organization itself recognizes, we will have other infections in the future, other cases of influenza. And I hope this one will be an opportunity to learn and develop strategies that are effective in the future, in terms, not just in terms of state actions, but also in terms of global coordination about what to do in those situations.
Thank you very much. I have a very brief question for each of you, and then we will open it to the questions of the participants. For you, Naomar, the notion in the Guardian newspaper from Britain this afternoon, in the article in which they discussed President Bolsonaro's firing of his health minister, they mentioned the results of a study of a British university that in Brazil, without any further measures to really bring down the spread of the virus, 1.1 million people could die. So for Professor Naomar, is this a realistic estimate from your point of view?
Well, this is the worst scenario, and I would say that it doesn't apply because independently, several states and regions, for instance, in the Northeast, 9 states got together in a kind of consortium against the federal government. And this is what Elize was saying, that these states have got a kind of a spontaneous coordination. But so this is your scenario. The most positive scenario in the Imperial College of London study, which is the one you mentioned, is that we are going to have at least 44,000 deaths. But the realistic scenario, not the most optimistic, is that we are going to have more than 200,000 deaths. Which is a massacre in terms of the population, especially because we are expecting, I don't know if that is happening already in the US, a social segregation of who are going to be dead or not. Because the people from the elite, from the powerful ruling class are already protected in their shelters and just will wait for the storm going on, but not the people, not the poor people, and not the vulnerable, not the black, the quilombolas, the Native American Brazilian people. They are not protected. And that's a point that we do have in Brazil, a kind of national health system, and the intensive care units that belong to the public sector are already in these places totally crowded. And, but the same does not happen to the private hospitals. And so we are going to expect a really unequal result in terms of the population.
Thank you. And for Professor Elize, following up on what you just said, raising the issue of class, race, ethnicity as determining who lives and who dies in the face of this epidemic. Elize, you mentioned the importance of qualitative research. One of the cities most impacted in terms of deaths per 100,000 in the United States is Detroit, Michigan, a city that's 80% African American. And a recent article in the New York Times, the reporter traveled on a city bus in Detroit with workers going to work, crowded in, overwhelmingly African American, desperate because they had no alternative. This is a qualitative study giving a new dimension. What do you mean, Elize, by qualitative studies? If you could elaborate on that just for a moment.
That is a sort of ethnography of the disease. It's very dangerous to do ethnography at this moment. I don't recommend to students and to researchers to do that at the moment. But I think we can do things at home, such as getting access to documents that the governments around the world are issuing, the World Health Organization, how they are dealing with this epidemic day by day. We know that timing, it's an important thing in this epidemic. How countries react a week after the epidemic started was different from knowing anything. Like Brazil, we already knew what to do and the importance of quarantine. So tracking down the steps of what governments are doing in terms of document research. You can also get access to newspapers around the world. Everything is online now. And if possible, to conduct interviews with decision makers or with workers in the field, like health professionals. Professionals working in the field is also something that some of my colleagues are doing here, interviewing health professionals, how they are dealing with the situation, how is their daily experience with the pandemic. And so I think this is something very important in terms of ethnography. If someone is able to get close to the crisis, the epicenter of some of this of the crisis is also very rich. So we can understand the behavior, why seniors are so reluctant to stay at home, for example. This is something, how to change the behavior of the population so they can, changing behavior is something very difficult. It's not something trivial to do. So we need to understand how people think, how people understand this epidemic, their necessities, so governments are able to propose public policies that are better informed and try to reach the population with a language that they can access and understand the importance of staying at home. So I think this is something that we can provide. And I'm saying that because we know there's a lot of biomedical and epidemiological studies that are very important at this moment. But also we need to pay attention, funding agencies, they need to pay attention to other kinds of research and how they can inform policies as well.
Thank you very much, and thank you for the very clear and appropriate warning. Do not try ethnography in this current environment. But your emphasis on qualitative research, I think, is a very valuable contribution to trying to understand and mitigate what's taking place. So with that, I'd like to turn this over to my colleague, Ana de Carolus, for questions from participants.
Thank you, Professor Shaken. Thank you, Professors Naomar and Elize. We have several questions from the audience. I will start with two. This one is for both speakers, coming from Beatriz. Is there any cooperation between health professionals in Brazil and health professionals in other South American countries? For example, sharing of information or other significant data that can be helpful for multiple countries in the region. That's one of the questions. And another one we received from Regiani. If you could share also, both of you, any thoughts on initiatives from favelas such as Paraisópolis, where citizens are coordinating their own responses in light of governmental negligence. So perhaps Professor Naomar, if you would like to begin with any of the two, and then we can switch to Elize. Thank you.
Okay, I take the first question and leave Elize for the second one. Yes, there are several networks. Brazil has a quite well developed a community of epidemiologists and public health workers. We have national meetings with more than 10,000 people getting together, and we are organized, but not only within the country, but with the several connections with other networks, because science these days is not anymore made in the solitary lab, and everybody is connected. There are networks for everything, and Brazilian are quite active. But I'd like to take the opportunity to mention that the example of Argentina is quite interesting, and I think that we should follow up about what is happening there, because the lower rates that they are getting, either for cases or for death, the death toll is much lower there. It happens definitely for the issue of coordination, central, federal, and the provincial and the municipal, at the county level. So that is the key to fight the pandemic. So a pandemic is a kind of global phenomenon. And then I'd like just to add quickly, if you let me do so, is that the issue of a qualitative and quantitative, in my opinion, do not apply to a pandemic. We have to somewhat overcome the boundaries, because epidemiology is not enough to deal with that, not virology, not biochemistry. We must have some kind of a more integrated approach, because a pandemic is from the political and ecological levels down to the molecular and the clinical level. And that's what I've been calling ethno-epidemiology, is what we need at this moment.
Thank you, Regiani, I guess, the name of the person that made the question. And I think that's an interesting question and a very important one. Actually, it's something that is happening in Rio as well, but in a different way. What we see in some of the favelas in Rio is the drug dealers, they are organizing the quarantine. In the absence of government, they are doing themselves. And I was talking about this with a student last week, and we name it coercive quarantine. It's not voluntary. It's not, because the drug dealers, they go around the city saying, go home, otherwise something bad will happen to you. And they are forcing the population to stay at home. It's very difficult in the environment of favelas, because you cannot get social distance, to use the correct word, when you live in a one-bedroom apartment. And so it's very difficult for them. They live in a sort of studio to facilitate their understanding. It's very difficult when you have an entire family living in a situation like that. There's no social distance in that situation. And also they need to work. So that's why social policies that allow the population to stay at home. It's very important in this context. We need to have also government support to informal workers and poor people so they can stay at home for a certain period of time. And this is something that Brazil is trying to do as well. And getting the money to the poor people is something that they are trying to solve and understand. But she's correct. Like in this situation, the government still don't have an answer of how to deal with that situation in poor regions and favelas, for example. So they are organizing themselves around this.
Thank you, professors. I have two more questions from the audience. Again, the questions are for both of you. For this one, perhaps Elize, if you could share a response to the following to both. The first one says, as human rights organizations, what is their role and what can they do to push Bolsonaro to take COVID-19 seriously and to protect quilombolas, Afro-descendants, and indigenous peoples? That's a question from Anna. And the question from Julia, there are some similarities in how the presidents of the United States and from Brazil have responded to the pandemic. Can you reflect on the role of the subnational governments, states, departments, municipalities in each one of those countries?
Elize, you go first.
Okay. Well, yeah, there are some similarities in terms of how the presidents are dealing with the epidemic as well. And well, in the United States, state governments has a lot of, they have more freedom than in Brazil, how they want to shape their policies. This is something that it's sort of innovative in Brazil, because for a long time, state governments, they were not at the forefront of health policy, and this is something new for us. Yeah, but Julia is correct when she points that the similarities between both. I don't know a lot about how states are in the U.S. are dealing with that. I understand that New York, it's a huge epicenter of the epidemic, but probably the reasons for that differ in Brazil and the US. I don't know. New York is also a state that has a lot of tourism, as Professor Naomar was saying. Probably has something to do with that as well. Probably the delay in responding to the epidemic in Ceará and Amazonas could explain that as well, same as New York. But the second question in terms of human rights, I think civil society in general has a very important role in pressuring the government to act. In health policy in Brazil, that's been a rule. We have a lot of civil society organizations and social movements that pressure the government to act. And I think they're very important to monitor what is happening with this population and trying to find solutions as well, and pressuring government to act. And I think they are doing that already, to be honest. I follow some of them on Facebook, and I can tell they are very aware of the situation. They are already pressuring for compulsory license in case a vaccine or some sort of drug is developed, so everybody can have access to that. Yeah, but I think they are acting already, in that sense.
Well, I can perhaps take part of the first question. No, the second one about Bolsonaro and Trump. The similarities are more than obvious, especially because Trump is a kind of role model for Bolsonaro. And that has produced much of embarrassment for our country, because he tries to mimic what is worse in Bolsonaro and in Trump. But regarding the pandemic, something quite strange happened is that they set up a meeting right on the edge of the pandemic. And then Bolsonaro crew was in some way responsible for bringing to Brasilia out of Florida the first outbreak outside of Sao Paulo. 23 out of 30 of the people who came with Bolsonaro tested positive for the COVID. And it's amazing because Bolsonaro does not want to show the results of his test. And the whole country is betting that it was positive. And it's a kind of state secret. And the other thing is that they copied in a sort of strange way. And yesterday we were rehearsing for this, and I told the story that they invented a kind of concept that is not a concept because it doesn't exist in any place in the public health glossary. They call it vertical isolation, which means simply the isolation of the elderly, which is the contrary of the idea of quarantine. In a quarantine, you isolate those who are contaminants and not those who are the receivers, the potential receivers. And they try to push that idea, which is a crazy one. And then I became interested in that, in a sort of analysis of the rhetorics of the pandemics. And I just found that Trump proposed the same thing on March the 22nd. He proposed that in the US. And that came from an opinion article from someone who was not an epidemiologist, a kind of nutrologist, who said that in his family, he wanted to do the vertical interdiction against the horizontal interdiction, which doesn't make any sense. And that's one of the major things that provoked a kind of clash between him and his former Minister of Health, because the guy wanted to follow what science says. And Bolsonaro said that he wanted to follow what his guts said. It sounds familiar to you? Thank you.
Thank you.
Thank you to our audience who submitted really interesting questions. And now my question is for Professor Shakin, if you might have any questions before we wrap up.
Just a brief concluding remark. I would like to thank very much Professors Elize and Naomar for a fascinating and critical discussion. Two comments on it, and I hope that we will be able to do more of these discussions as this crisis continues to unfold. When I first read about Naomar's work on ethnoepidemiology, my initial reaction, I must confess, is what exactly is that? After this discussion, I understand ethnoepidemiology is vital to understanding where we are today. As important as epidemiology is, alone it cannot address this. As important as ethnography is, alone it provides insight, but not enough. Bringing them together is critical. That's one dimension. And in terms of what Elize was emphasizing about qualitative research, but also about the importance of institutions and coordination, is a vital dimension of any public policy and any self-organization that really is meant to engage this. The challenges, tragically, are very much also ahead of us. Learning from the best models and learning from these kinds of insights, I think, are critical. So I want to thank both our participants and the Center for Latin American Studies, and those who participated in the webinar for making all of this happen. Thank you, and we look forward to seeing you soon.